guys begin?
I can't tell. It's 8:50.
What's our time?
We can go right ahead, because a minute here, a minute there, it all starts to add up.
All right, I can do it. Angela, would you like to lead us in the Pledge of Allegiance?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning, everyone. Welcome to Shawnee County Board of County Commissioners. It's July 13th, 2020. And on my left at this new desk is Commissioner Aaron Mays, who represents District 3, and on my right is Commissioner Kevin Cook, who represents District 2. I'm Bill Rippon, and I represent District 1. We need to pull one item from the agenda. That would be C1. Okay. All right. What do we have on first?
First item is number 1, proclamations presentation. Presentation on the 2019 financial audit by Kristen Hughes, RSM US LLP.
Is she on the phone?
She should be.
Okay.
Kristen, are you there?
Hi.
Yeah, this
Yes,
is,
this is Kristen. Can you hear me okay?
Yes.
okay, this,
Okay, great.
I'll let her go ahead.
And I wasn't sure if Betty wanted to say anything, or if you'd just like me to
Well,
go ahead and start.
Yeah, I will go ahead and say a few words. Betty Greiner, Director of Administrative Services. RSM is still working from home, and they're not going into their offices, so Kristen is joining us by phone today. You should have had the audit reports in your packets, and each year she just kind of gives an overview to the commission of the audit, so she will do that for the 2019 audit. So, Kristen, I'll let you go ahead.
Great. Thank you, Betty, and thank you all of you for your flexibility this morning. I'm going to go ahead and, as Betty said, give a high-level summary of the deliverables, and then if there's any questions when I'm done, I'm happy to go through those as they relate to either the deliverables or the audit process itself. As far as the financial report, first thing I'll point out on pages 1 and 2 is our independent auditor's report. You'll see there that we did issue a clean opinion, as people call it, or under AICPA terminology, what's referred to as an unmodified opinion, meaning the financials are presented in accordance with GAAP, no material deviations there. So that's obviously a positive to report. That's the best audit opinion that the independent auditor can issue on financial statements. Right after that, I would just point out to you is the section referred to as Management's Discussion and Analysis, or MD&A. I like to point people here just because it's really kind of a subjective area of the report where management goes through and analyzes 2019 results compared to the prior year and highlights if there was any significant changes, and if so, why those occurred as compared to the prior year. And then in the financial statements following that, as a reminder, in the financials, you'll find individual financials, meaning balance sheet and income statements, are presented for each of the county's individual funds. And then as well, at the beginning is what's referred to as the government-wide. So not only will you find the individual financial information for each fund that is individually tracked and budgeted for, but as well, financial statements are presented on the consolidated level, which combines all of those funds together to represent the county's financials as a whole. So again, any individual financials you'd like to look at or particular funds, all of that information is in the financial report. Behind the basic financials are the footnotes, quite a few footnotes. You all have met all the required disclosures. And just as an example, in the footnotes, you'll find additional information on topics such as capital assets owned by the county, all outstanding debt that the county has. So it's presented in a roll-forward format, as well as future information on upcoming maturities and interest rates paid on that debt. You provide detailed information on pension benefits offered to employees, and as well as post-retirement benefits offered to retirees. Next document is the compliance report that I was going to touch upon. So the compliance report, that's a separate PDF. What this goes through is the first few pages. When an audit is done under government auditing standards, it requires the auditor to issue a letter in consideration of controls. And because you all have a single audit, which as a reminder is the audit work done on the federal grant dollars, we actually issued 2 of these letters in essence. So in the audit world, we have a responsibility if we become aware of any material weaknesses or significant deficiencies, auditing standards do require us to communicate those to you. There were none this year, which is a positive to report. The government auditing standards require us to issue these letters regardless of what the results were. So in other industries, if there were none of those deficiencies identified, a letter, for example, wouldn't even be issued. But under government auditing standards, that's what you'll see really in the first 4 pages of this report, is that we go through and issue the standard letter. We define what is a material weakness and a significant deficiency. That's going to be relative to both the financial statements as well as the grant spending. And then, as I mentioned, none were identified during the course of our audit, so you will see that stated in both letters. I would like to point out, though, as a reminder, a financial statement audit is not designed. The focus of our work is not to come through and analyze all of the county's controls. Certainly, we focus on the ones that are significant to the financials, but the county as a whole, when you think of all the departments collectively, et cetera, there's a lot of processes and controls in place, and we're certainly not taking a look at all of those as part of the audit. So the letter does also just give a reminder that while none were identified, there is the potential that deficiencies could exist that were not identified as part of the audit process. On pages 5 and 6 of this report, the county prepared what's called the Schedule of Expenditures of Federal Awards. So this is a summary of the federal grant dollars that were spent during the year by each of the separate grants that the county receives. So in total, the county spent about $2.7 million in federal grant funding during 2019. On page 9 of that report, I'd like to point people here. This is actually a really good one-page summary of the audit results. So if you have this page in front of you, what it does walk through is, again, it notes what the opinion was mentioned earlier, which is an unmodified opinion on the financial statements. It summarizes, again, specific to the financial statement audit, that there were no material weaknesses identified, no significant deficiencies, and no material non-compliance was identified. It repeats that same thing for the federal awards or the grant audit. So again, no material weaknesses or significant deficiencies or material non-compliance was identified during the compliance audit. This also tells you which specific grants we looked at. So you'll see here we audited. So while the county has $2.7 million that was spent, as I mentioned, that's spread over several grants. So our standards require us to go through and select a couple of grants to audit, or we had a couple this year. We have pretty specific guidance on how we go through and identify the grants. So we audited WIC this year, which is the county's largest program, and then we also audited Medicaid because the granting agency has specifically deemed this one a high-risk audit, not specific to Shawnee County, but in general, any entity that receives this funding is a high-risk grant. So we audited these 2 major programs, which represented about 55%, I believe, of your total spending, just so you have perspective on how much of the grants we looked at. And then lastly, to point out, Shawnee County, due to clean results the last 2 years, does qualify as a low-risk auditee currently. That's a good thing for you all to know and to be able to say that you've met the criteria to be a low-risk auditee. And just so you know, the impact it has on our audit work, when you are a low-risk auditee, that requires us to audit 20% of your federal grant dollars versus if you're a high-risk auditee, it requires the auditor to audit at least 40% of the total spending. Last document is the auditor communications, and what this is at the conclusion of each audit, auditing standards require there are certain topics that the audit firm has to communicate back to those charged with governance of the board. So here you'll see on page 1 these topics. As a reminder, it recaps what the responsibilities are for both parties. These were identified in the arrangement letter that would have been signed before the start of the audit. So really, it's reminding the standards that an audit firm is going to follow, and then it reminds that management's responsibility as they relate to the financial statements, as well as the information we're provided during our audit. This page also notes that it identifies areas of the financials that represent significant estimates. So this could be areas of the financials where management is having to estimate perhaps a balance at year end. So examples would be those pension liabilities that you have. Those are going to be an estimate. Similar for areas where you have self-insurance or estimating what you think that liability will be at year end. So just to confirm, as part of the audit process, we do take a look at those, make sure the process being used by management in coming up with those amounts appears reasonable, both in comparison to the county's policies as well as what we would expect to see the process just for your industry as a whole. We communicate if there was any audit adjustments. So you'll see this year, I believe, where there were just 2, which is good. So what this means is, in comparison to the original trial balance we were provided at the start of the audit, just 2 adjustments were identified that have been incorporated into the final product. So if you have those in front of you, you'll see really small amounts. Each of those adjustments was less than $20,000. So a lot for the auditors firm to pull together the financials for all the funds you have. So that's certainly a good thing to note, that when we come in and do our audit work, we're not identifying a significant number or dollar amount of errors when we start our audit work or as we're working through that process. Lastly, you're provided with a copy of any written communications between ourselves and management. So attached at the back of this document, you'll see what is referred to as the management representation letter. It's just a letter signed at the conclusion of the audit, but it is those involved in the audit process confirming that both the financial statements are accurate, complete to the best of their knowledge, as well as all the information we would have been provided with as we were performing our audit testing. So I'll go ahead and stop there. That's really the items I wanted to recap in the audit deliverables themselves, but I'm happy to go through any questions you have on those or the audit process itself.
Thank you, Kristen. You have any questions?
I don't have any questions. I just want to thank Kristen for her time and efforts and professionalism, as well as all of the time and effort that went into the audit through the Audit Finance Department, and glad that we were able to have another clean report, and I think that's a benefit to the county.
Congratulations, Betty.
Thank you. I
good
just
news.
want to thank Kristen and her, I'm sorry, Commissioner, did you have something?
No, I was just,
I just want to thank Kristen and her team. This was the first time we did an audit completely remotely. So that was kind of a new experience, but I think we worked through it very well. I'd like to thank all the departments that helped work through this with us. And we worked through it as a team, and also would like to thank all of my staff, of course, that this is something that we spend a lot of time on, working with them on it. So I want to thank all them. I do want to mention, as Kristen kind of mentioned a little bit too, the primary purpose of an external audit is not to catch fraud. They are looking at the numbers and how they're presented, and that they're presented fairly and accurately. And they do look at internal controls, but the primary purpose is not to find fraud. That is why we have internal audits that we do. We have an internal auditor in-house. We have our fraud hotline. So, I think a lot of times that is a misconception that the public has, so I just want to throw that out there. Not that we are aware of any fraud that we have, but we do take additional steps that we would try to locate any if we, did have any information that indicated that.
okay, thank you.
Thank you.
Job well done.
Thank you, Kristen.
Betty,
Thank you.
what they have to
All
say?
right.
Oh, I'm sorry, one more thing.
They have to have a motion.
Yes, I would ask that you accept the audit report as presented. Is that the right word, Cindy? Accept
I
it?
would so
So
move.
moved. Oh,
Second.
second.
Right. There you go, one or the
Good
other.
job. So that would be.
Motion's been
a-
made by Commissioner Cook and seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. That was scary. All right.
Okay. so
Next
she's-
up,
okay.
okay, Kristen, we're going to hang up on you here.
Thank you.
Thank you very much.
Thank you again. Enjoy the rest of your day. Bye-bye.
All right, next item.
Next item is item 3, consent agenda.
I move that we approve the consent agenda. Second. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
Item 4, new business. A, County Clerk number 1, consider all voucher payments.
Commissioners, this morning we have vouchers that total $1,335,534.59. The highest is out of our payroll, which was $634,892.07. Health insurance premiums for our employees of $240,988.33. Allocations was $167,166.00. And finally, holding accounts with the state of Kansas of $59,424.48. This made up the bulk majority of the vouchers. I've reviewed the vouchers and have no questions. Would move for their approval.
Second. Motion's been made by Commissioner Cook, seconded by Commissioner Rippon. All in favor, say aye. Those opposed, motion carries 3-0. Next item.
There are no correction orders today. We had we're having our software, our real estate software moved from one server to the other over the weekend, and they were still taking the bugs out of it, so we will have your report next week. Sorry.
Okay, thank you. Next item.
Item B, emergency management, number 1, consider approval of resolution number 2020-45, declaring the state of local disaster emergency in Shawnee County, Kansas, shall continue and remain in effect until December 31, 2020.
Good morning, Commissioners. Aaron Mahan, Shawnee County Emergency Management. We are in a under a current emergency declaration. It is set to expire on Thursday, July 16th. We are asking that you would extend that through December 31st. Basically, all that does is it continues our participation in acquisition of PPE from the state and other resources, and participation in Spark funds and the CARES Act.
Any questions?
Yeah.
I'll move for approval. Second. Motion's been made by Commissioner Rippon, seconded by Commissioner Mays. All in favor, say aye. Those opposed, motion carries 3-0. Thank you,
Thank you,
Aaron.
Commissioner.
Next item.
Item C has been pulled. D, Parks and Recreation, number 1, consider approval of request to utilize 2020 contingency for the emergency purchase of the failed main circulation pump at Bladesdale Family Aquatic Center in the amount of $12,165.29, and a request to pay Central Mechanical Construction for the repair services.
Good morning, Commissioners. Tim Laurent, Parks and Recreation Department. On July 2nd, we did receive permission from Audit Finance to make an emergency purchase of a main circulation pump for Bladesdale. This was an unforeseen expense, and in order to maintain the purchasing policy, we're asking that you approve that emergency purchase here today. I'd be happy to answer any questions that you might have.
Questions? I'll move for, oh, go ahead.
All right, Betty Griner, Director of Administrative Service. No, we're not asking for the emergency purchase approval. We're asking for the contingency funds to pay for this.
Thank you.
What she just said. I'll move for approval.
Second.
Motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Those opposed, motion carries.
Thank you.
Thank you. Next item.
Okay. Let's see, item E, facilities maintenance, number 1, consider approval of request to accept contract pricing from Simons Industry, Inc. for repairs to the proprietary Simons fire alarm system located at the Manor Conference Center, 1720 Southwest Western.
Good morning, Commissioners. Bill Kroll, Facilities Maintenance Director. The fire alarm system over at the Manor Conference Center is starting to get old, and it's also a proprietary Siemens system, and local vendors are unable to work on it. So we need to contact Siemens to get them out there to see what's wrong with it so that we can complete required annual testing and things. And Siemens has sent us a non-contract price agreement that we need to have approved before they will let us contact their reps to have them come out and work on the thing. So that's what we're asking for. Don't know what it's going to cost totally, but we do fund the Maynard Conference Center from the rental funds that we get from the hotel. We don't? We used to.
I'm sorry. Betty Griner, Director of Administrative Services. Maynard Conference Center, we have talked about that in the future when we get a new lease with them, that we would set money aside for that. But currently, that is funded either through general fund, or we did have some deferred maintenance money that we used in the past. So this would be expensed out of general expenses.
What Betty said.
Okay. Do we need to redo the audit? No. I'll move for approval.
Second.
Okay, a motion's been made by Commissioner Rippon, seconded by Commissioner Cook. All in favor, say aye. Motion carries 3-0.
Thank you.
Bill. Okay, next item.
Item 5, administrative communications.
Okay, at this time, we allow anyone from the public who'd like to make any comments, or the different departments who'd like to make their announcements or comments.
Me again.
Okay.
Betty Griner, Director of Administrative Services. I just wanted to give you a little update on the coronavirus relief funds. As you know, that was part of the CARES Act, and our Spark Committee is soliciting information from all of the Shawnee County taxing authorities for all of the eligible, reimbursable COVID-19 costs they may have from March till current, and then also from now through the end of the year. We're asking them to send in information on that, so we've sent them a survey to fill out. And then once we get those surveys, the Spark Committee will develop an assessment policy and then look at the different amounts and come to the commission with a recommendation on how to allocate those funds. The surveys from all the different organizations are supposed to be back in on Friday, by Friday, the July 24th, which gives them 2 weeks to work on this. And we have set up a separate email account, which is ShawneeCountyCares@snco.us for them to respond to. And like I say, then after we get those back, the committee will then analyze these, look at the different needs, and come up with a spending plan that then will go to the state. And we will also be working with the Shawnee County departments for that same purpose. So just wanted to give you an update on that. Any questions?
Betty, when did you say that email went out to the tax?
Last night.
Okay, and do you anticipate an influx of responses and questions right away?
We have already received a few, I think,
Okay.
but we may, yes. It went out under this email address, so then all the questions would come to one location, and we can get those out. And I do anticipate if we do get a lot of questions, we may send them some more information that is as it becomes available.
But July 24th is their deadline?
To get this survey back to
Back
us,
to us.
yes. Mhm. That gives them 2 weeks, all this week and all of next week.
It's a short,
It is a short time
it is.
frame, and we have been working with the consultants to get these, this survey and together. And it is a very short time span, but that is the based on the time frame that the state has given us. It kind of all, how it kind of flows down. So.
Okay, thank you very much.
Good morning, Commissioners. Linda Oaks from the Health Department. I have Dr. Gianfranco Pizzino with us this morning to give us an update on COVID-19.
There is somebody from the public who wants to speak. I don't know if you
Oh.
want me to go first.
That'd be fine. Go ahead.
Okay, thank you so much. I appreciate the
the time. My name is Janlyn Nesbitt Tucker, and I am a small business owner. And first of all, I understand that the waters that we're charting these days are very tough because we just don't know what we don't know. There is information that's coming out, but those things seem to change a lot. The reason that I wanted to visit with you all this morning is I wanted to tell you a story about something that happened to me Thursday. I had a meeting with a fellow business owner, and we were at the Classic Bean, and there were probably 6 to 10 people that constantly made up a line that went through their register to order coffees and such. It was about 1:30. We were having our meeting, and I was looking around thinking, gosh, this is great. So many people that are starting to come back out because small businesses have really taken a hit throughout this last 6 months. And as I sat there, there was a little kid, one of the kids that works there, started coming around to different tables and different sofa groupings and said, okay, now we're going to have to leave and we're going to have to close down, so y'all need to either zip up your coffee and take it with you, but at 2 o'clock we have to close down. And I said, what is this for? Well, it's deep cleaning that's mandated by the county. And I said, well, and I looked across, and the tables were far enough apart that, I mean, I didn't feel vulnerable at all. I was with a group of 3 people that were having a meeting, and I saw all these, the 6 to 10 people that were in line just disperse. And I thought, my goodness, if a coffee is $3 to $5, and you don't know how many people are ordering for numerous customers, it really was pretty disheartening. So anyway, we sat there at 2 o'clock. Everyone got up and went outside, and they did not sit in the public area because it was 90 degrees outside. It's kind of hot. And who's going to sit there for in 90-degree weather waiting for them to open back up? Those are customers that were lost. So I left feeling so bad for Classic Bean. And I got to thinking, I'm sure that they are not the only ones. And I thought to myself, what constitutes deep cleaning? These guys are regulated by the health department, and we have not had a significant outbreak of anything for years and years and years that the health department was not on top of. And I went on to remember that just 2 or 3 weeks ago, and y'all probably are aware of this, we had 2 restaurants, I'm not going to tell you who they were, on Wanamaker that completely closed because there was a fear of contamination because one of their employees had tested positive. This is what people assume. One of their employees had tested positive, and they wanted to make sure that the public was safe. And the reason that I'm here is because on Friday at 7 o'clock, there was a news release that was released from the communications department of the county that announced a modification to the cleaning procedure that y'all have in place, which is great, but that was Friday at 7 o'clock. As a small business owner, and I'm not a restaurant owner, but because they're all working right now, and we have a different type of business model that allows me to be here this morning. As a small business owner, they're busy. They don't typically have time to keep up with something that comes in at 7 o'clock on a Friday when they are in the middle of their, dinner run. It is so disappointing that we seem to have lost trust in our business owners, in our restaurants, in our in the people that we need the most. the ripple effect that is caused from not allowing or overreaching and over mandating things is just so significant. That 1 hour, I'm sure, for the Classic Bean, and I probably shouldn't have even used their name, but for any restaurant between 2 and 3 on that short of time frame that y'all put in place, the ripple effect for their workers, their supply vendors, it's something that I don't think that any of us really understand unless we're small business owners. The more that we change things, we flip-flop a lot. And the more that we change things, the less confidence the public is having in the process that you, as our leaders, are putting in place. And I would just ask that you reconsider how you are overseeing this, because I think that as small business owners, we have to trust that you don't get into small business just because. You don't open up a restaurant just because. You make a promise to the community that you are going to do your very best to serve the very best, to offer the very best product, to have the very best people serving you, to keep people safe, and to continue to change, to continue to have the targets move. Doesn't say a lot about who we are as a community. It says that we don't trust our small businesses. And it says that small businesses, such as our restaurants and our coffee shops have a margin of about 18%. That is so small. It says that we don't value them. So in closing, I just want to remind you that it is small business. It is small business throughout our country, and not government, of which we are here. It is small business that is going to pull our economic recovery out and into the positive. And the more interference that we have, the harder it's going to be. Small businesses have lots of hoops to jump through. I would just ask that as our leaders, as our county leaders, that next time, and even, based on what's already in place, that you consider easing up control so that our small businesses can do the jobs that we know that they can do. I appreciate the opportunity to visit with you all and to share my comments.
Thank you, Jan. Dr. Penzino, I have a question. In your standing order that you have right now, you're requiring this 1 hour of shutdown? for
Not
deep
anymore,
cleaning?
not since Friday.
What's this?
Not since Friday.
okay.
We
All right.
require 1 hour of deep cleaning, which is different from the regular cleaning that, of course, all businesses do throughout the day. And originally, we required that they close down during the hour, and now Friday we clarified if they can do the deep cleaning while stay safely open, they can remain open.
Okay. All right. That sounds like improvement. I had an experience. I went to a restaurant this last Friday, and when I got inside the door, they said I'd have to put a mask on to get to my table. And since I was going to a restaurant to eat, I didn't figure I'd need a mask on. But anyway, they sold me a mask for $1 so I could go to my table. And of course, then I could take it off to eat, but then I put it back on to leave. Is that one of our requirements now, or is that just a restaurant requirement?
Do you want to address that, Jim, or? That is one of the requirements that the commission approved with the mask order or resolution.
Okay,
Yeah.
just checking.
You can remove it while you're eating and drinking, of course, but there is no exemption for restaurants. In fact,
Right.
restaurants and bars, as you know, are
Okay,
consider a high-risk activity for transmission.
Even though when you go into a restaurant and you're walking to your table, I mean, you're not socializing with anybody, you're just walking.
Maybe you're not. I mean, the more exceptions we introduce, the more loopholes there are through which an infection could be transmitted. Maybe you're just walking straight to your table and always keeping 6 feet of distance. Maybe you're not. Maybe you're bumping into somebody that you know and you're going to start a chat with them. I mean, we can't address each specific situation one at a time in a different way without really creating, I mean, the number of permutations and combinations that are available is infinite, essentially. So we need to have some rules that apply that can both protect the health of the public and hopefully be manageable at the level of the consumers and the businesses. We did realize after the order went in effect last week that this hour of interruption of closing during the day, even though it had been discussed with some business owners and none of them really raised huge concerns, but obviously we realized very quickly that it was causing big problems, so that's how we issued that specification, clarification on Friday, and so hopefully that will take care of that part.
Thank you.
Yeah. Gianfranco Pezzino, Shawnee County Health Officer. I have the update with numbers for you, and this week is going to be a little different because since we are lagging behind in entering our data and analyzing the information, what you see here, the most current week you see is the week that started on June 28th, which is essentially the week that ended on the 4th of July. So you can see that during the week for the second time in a row, we almost doubled the number of cases, about 80% increase the number of cases over the week before. As I said, we do not have the data from last week, but I can tell you that last week we also went up. I don't expect huge changes from one week to the other, but Black or African American people are still disproportionately affected, and so are Hispanic people, even though for Hispanics, the share of cases has slightly gone down from, it was about 50% at its peak a few weeks ago, it's now down to 36%. But still clearly a disproportional share of cases compared to how many Hispanic people we have in our community.
Dr. Pezzino, what is the demographic numbers that what we have? I mean, what is our Hispanic population in
The Hispanic population, I think, is about 12%, if I'm not mistaken, in the county.
Okay.
And so, yeah. So essentially, you have 3 times as many as you would expect. If the virus was equally distributed, you would expect to see about 12% of cases among Hispanic, and you see 36%. Number of tests performed, we remain at the high level, a little bit of a drop on the week of the 28th, even though the number of cases went up dramatically. So once again, another reminder that our cases are not going up. I have to emphasize that, are not going up because we are testing more. There is absolutely no doubt about it. And another reason we know that is that the proportion of positive tests that are performed is going up. And the week before last was the 3rd week in a row that the proportion went up. We used to hover around 4.5% to 5%, and now we are approaching 10% mark, which is usually considered as a level at which it's considered a level that indicates a heavy community transmission in a community. So we are very close to that level. We already knew that we have a lot of transmission, but that's considered as a marker for that as well. When you look at the percentage positivity for tests done by our clinic for the Shawnee County Health Department twice a week, that's even higher. We are around 25%, between 20 and 25%. Again, 2 weeks ago it was 25%. So really high number. Remember, this clinic is conducted twice a week in East Topeka, and we suspect that it attracts several individuals that otherwise would have difficulty in accessing testing done in other sites throughout the county. So those are clearly high-risk individuals, and probably that factor is reflected in this higher number of 25% positivity rate. As you know, this is another marker that we look at, is how many cases, what proportion of cases we do not know how they got the infection. Now, for the most recent week, the number may drop slightly, although I don't think it will for the week of the 28th. And the reason is that we are still catching up with cases, and so the more information we gather during the interviews, of course, the more we are able to confirm the source of infection. So essentially, a new case will default to no known source of infection. And then through the interview, if we can identify the possible source, then we will adjust accordingly. That's why I believe the last update we gave you was close to 50% unknown source. That number then dropped, that would have been for the week of 21st of June, dropped to 37%. But still very disconcerting. Again, it's 4 weeks of increases in a row, and it seems pretty clear to me that we have more virus circulating, and people are contracting that virus without knowing exactly where they get it. Hospitalizations, again, this is the week of 28th of June. We have 16 hospitalized patients. I will talk about hospitals a little bit towards the end as well, because I have to share some more information. I think just looking at number of patients hospitalized doesn't tell the whole story about the burden on our hospitals. This is a cumulative age distribution for the entire pandemic period. And unfortunately, we haven't been able to break this down by week yet so that we could see trends. But I can tell you that the trend was that at the beginning, these age groups on the older side were more common, and now these age groups, on the younger side are more common. And if we were to look just at the last 2 or 3 weeks, these numbers of young people would be even higher than it is now, because again, there has been a shift of infected individuals more towards the younger side. And Commissioner Rippon, I apologize. I know you asked me to change the color, and I forgot. So we will try to do a better job next time. But this is our summary, and the font is also very small, so my apologies. This really needs to be improved. But essentially what we saw is a sharp increase for 2 consecutive weeks in the number of cases, an increase of 3 consecutive weeks in the percentage of cases that are positives, an increase for 5 consecutive weeks in the percentage with no known source of infection. Hospitalizations increase over 3 weeks, and I believe we had 3 deaths during the week of the 28th of June. This is the capacity scorecard for the health department, and I wanted to put side by side the one for 6/28, which is that's the week for all the data that I presented you so far, the 6/28, and then the one for last week. Okay, so you didn't see data in terms of caseloads last week, but we do have our scorecard for the health department. You can clearly see that there were already 2 red areas on the week of 6/28, but the red areas now increased to 3, and the situation is putting more pressure on the health department staff. So essentially now we are not able to locate and interview cases within 48 hours anymore. And I will show you in a moment why that matters. But our average now goes, I believe, is between 3 and 5 days, Linda? Is that ballpark figure? Hopefully that will improve, because we are pushing more and more cases down to the company that's doing that. But it still takes resources from our staff to even do that kind of work. And we have been no longer able to call each contact that's named by each of the cases, just because of lack of time and resources, and we ask each of the cases to notify their own contacts. And finally, we do not monitor contacts on a routine basis anymore. We don't call them to make sure that they are following the quarantine order and they are not developing symptoms. So I want to give you a little bit of a scenario here why this matters. Let's assume that this is our case number 1. And day 0 is the day that this case number 1 becomes sick. This person was infectious from 2 days before onset of symptoms. And so just before the onset was able to infect case number 2. After the person, case number 1, becomes sick, case number 1 goes and gets tested, and we get the result back within a couple of days, and the result is positive. Meanwhile, case number 2 has been infected already, and he or she is going through the incubation period, which can be up to 14 days, but typically on average is 5 to 7 days. If we receive the result back on day 3 after onset, we will do an interview immediately in day 4, and we will isolate the case number 1, and we will be able to reach case number 2 and any other contact potentially infected by case number 1 in time before they themselves become infectious and can propagate the disease. So you see this X here, meaning case number 2 is no longer able to transmit the infection because you are able to establish a contact and give instructions to quarantine themselves in time before they can spread the infection. Now, here is what happens if there is a delay here. So everything, as you can see, starts from case number 1 and our ability to reach case number 1 and his or her contacts in time to avoid further transmission. But if that set of activities spread out over time, here is what happens. If we interview case number 1 on day 6, for example, and we identify the contacts on day 7, it's too late. Case number 2 will be able to transmit the infection to case number 3, who then will be able to transmit the infection. And you can imagine how that keeps going. That's why it matters. That's why our timeliness is absolutely critical. And that's why getting results back is absolutely critical. And that's another bottleneck we are having these days. So I thought that maybe this can help you understand that we are not just obsessed about having a good performance. There is a reason behind that. If we wait too long, and here you are seeing just a delay of a couple of days, which is essentially the situation we are in right now, then the possibility of each case to infect additional people grows considerably. So there is my summary. We must keep the number of cases under control, or we are going to see more and more cases disseminated and infected because of this phenomenon, and we are going to see a problem with hospitals. Uh-oh. There was another slide, but that didn't get in. Okay, let me tell you what's going on with hospitals. I had a conversation actually this morning with one of our hospitals, and we had another call last week. The average census for COVID-19 right now between our two hospitals is just around 20, between 18 and 20. It depends, of course, on the day. That doesn't sound like a lot of cases, but first of all, the number is, for some reason, it's not distributed evenly. Somerville has more cases than St. Francis. I'm not sure why. But perhaps more important, what's happening with hospitals is that their concern right now is not having beds, is that they may not have enough staff to take care of patients. And the reason is that as of today, there were, I believe, close to 150 staff people between the two hospitals that could not report to work because they were either sick and they were awaiting test results, or they had to be placed on quarantine because they had been exposed to the virus. Now, both hospitals assure me they're going to take care of our COVID-19 patients. Those are top priorities. But if they don't have enough staff for everything else, they may not take care of the other patients, which means that the elective procedures that were just restarted about a month ago may have to be cut down again. And that has an impact, of course, first of all, on the health of our community, because some of those elective procedures are important. People have been waiting for a very long time. And number two, it has an impact on the financial bottom line for the hospitals, because, of course, they lose money if they can't do those procedures. So what one of the hospital's executives told me this morning actually was, I think we're focusing on the wrong indicator. Just looking at number of hospitalizations per se doesn't tell the whole story of the burden of COVID-19 on our hospitals. And we need to be sure that people understand that, and she asked me to convey this message to you. What should we do? I'm going to give you 3 possible options that are absolutely not mutually exclusive. In fact, I think we should do something along all 3 of those tracks. Number 1, I will work with our county councilor this week to see if there are some tweaks that we need to make next week to our orders and your resolution about masks. There may be a few loopholes that perhaps we can tighten up a little bit. But frankly, when it comes to the orders from the emergency orders from the health officers, there isn't much else left that we could do to achieve a lower number of cases. I mean, we are doing a lot already, and I will look for additional options, but I don't think we have a lot of them. Track number 2 is on enforcement. Clearly, I can keep issue all the orders that I want if people don't follow them. Speaking of exercise and futility, now I think that there is an effect of those orders. I think just looking around the community in the last 3 or 4 days, I do see more people wearing masks, for example. I also hear concerns from some people that there is still an attitude of defiance, and some people walk into a business and say, nope, I'm just not going to do it, make me. And there are very few recourses in that case. There have been some reports over the weekend about sports events where people were not following the directions that were given to them. So we have to look into enforcement. And I don't know exactly what we can do. Again, we'll have a conversation with the county councilor. I would submit to you as an option that maybe we have a conversation during one of these meetings or a Board of Health meetings with our law enforcement agencies and the DA, maybe inviting them to come here and see if they have some ideas of how we can fine-tune our enforcement. From where I'm standing right now, enforcement is pretty weak in Shawnee County. But I'm not in a position, of course, we are not, Public Health is not an enforcement agency. I'm not in a position to do anything without the support of law enforcement agencies. Track number 3, I think we need to do a better job at our public communications. Talking to the public, I don't know how many people in our community are aware of this information that I'm presenting to you every week or 2. I don't even know how many know that that's available on our website. I think many are not, because I get requests throughout the week and say, oh, I would like to know such and such and such, and why don't you release that information? We do release it on our website, it's updated every week. So that would be a first element. Always provide information is always the first step. But there may be also a need for some marketing-like campaign. I would love to see more billboards that promote safety measures in our community. I would love to see public figures in our community that are credible, that come forward and invite our community members to follow the directions of public health and this commission and things like that. So maybe one thing that we can look into is what we can do in that area and whether we need help from some people who are actually smarter than I am, certainly, in mounting and marketing and public communications campaign. There may be other ideas, I don't know, I'm looking also for your help or your input, but this is my bottom line. We must keep the number of cases under control. Actually, I would say we must reduce the number of cases, because right now, that is not under control. So probably that's not the best way to word it. We are not keeping our cases under control. We are having more and more cases in long-term care facilities. We're going to see more. We are going to see more. When you have so much virus in circulation, there is no way to keep compartments within our community separated. And I really don't want to see that.
Doctor, just like we saw from Memorial Day to the impact from Memorial Day, the numbers take time to report. It was only a week ago that we put the mask ordinance into place. Isn't it going to take some time to see what impact that's having?
Yeah, that's a fair comment. Yeah, it is going to it is going to take some time. Remember that mask is just one layer, though, of our control activities. So while, as you know, I strongly encourage you, and I thank you for taking the step, that alone may not be sufficient to bring the numbers back under control. But it's definitely something we need to monitor. And yeah, typically, it would take, between two and 4 weeks for any one action that we implement to see some results.
So at this time, when we put the mask ordinance into place, we refined the rules for bars and restaurants and continuing to work on that. It will take time for us to see the impact of our actions for at least another 10 days to 2 weeks to 3 weeks.
That is correct, and that is one reason I like to wait usually at least 2 weeks to make any changes after a certain order or action is implemented, and we're going to do the same. So the last public health order was issued last week. We are not going to change anything until next week. At the same time, there may already be some loopholes or unintended consequences that we can identify in the next week or so. And so maybe there will be an opportunity, even as early as next week, to make those actions and those requirements a little bit more effective. With the understanding that we haven't still seen the full impact of those because they were just issued last week.
I've always said all along, we ought to protect the vulnerable. And I was reading about, I think it was in Florida, where they're testing the workers at their long-term nursing homes and facilities like that. They were testing them every 2 weeks, all the workers. Do we do anything like that?
We are not in a position to test every worker. First of all, that's not information I have, that they test everybody in every nursing home every 2 weeks.
Well, not everybody in there, the workers, the people who
Well,
work in the facilities.
okay, but even that. But even if that is the case, we are certainly not in a position to do that here, and I wonder how they will keep doing that when the national labs now have a turnaround time of 7 days or more. Remember that what the test tells you is whether somebody is infectious at the time the test is done. And so getting the results 7 or 10 days later, oh yeah, you were infectious, you could have infected people 10 days ago, doesn't happen very much. Our nursing homes are doing a very good job in trying to do targeting testing, but they are stretched very thin as well, so they're doing what they can.
I think, Commissioner, that may be a better point that I get asked is who can be tested at this point?
Everybody who has at least one symptom that could be suggestive of coronavirus. People without symptoms are not routinely tested except when we do targeted testing like in a nursing home situation. We do that. If we have a case in a nursing home, then we will identify the narrowest circle around the case and we will test all the workers and sometimes even all the residents that fall within the circle, whether they're symptomatic or not. And then depending on that result, we may even go to a second circle, which is a little broader. So people without symptoms are only tested when they're parts of this targeted testing. Otherwise, everybody with symptoms can be tested. But again, KDHE lab now has a return time of 2 to 3 days, and actually KDHE requires 2 symptoms, not 1. And the Storm Valley and St. Francis, and they rely on national labs, and their return time is about 7 days, so that's a lot. Used to be about 2 days as well, and not anymore.
Your new cases, how many of them are probable cases and how many of them are lab-confirmed tests?
When I show the number of cases, those are all lab confirmed. We do not show probable cases.
Okay.
Probable cases, but interesting, you should ask that, Commissioner Rippon, because that's also a problem. In the sense that we have, of course, we love our acronyms in public health, PUI, person under investigation, and those are people essentially who are tested because they have symptoms suggestive of coronavirus and are awaiting the test result. Many of those people are tested in hospitals, And while they are waiting, while the hospital is waiting for a test result, they have to consider those patients as potentially COVID-19 patients. So they tie up beds, sometimes in ICU. And they cannot be released until the test result is back. So that aggravates the issue of overwork for hospitals. They have dozens, literally dozens of people that are PUIs that are waiting for a test result every day or every week, and they just cannot move them around because they could have COVID-19.
Are they considered hospitalized at that point?
Yes, yeah, okay, so some of them will not be in the hospital, no, right? Essentially, everyone who goes even to our drive-through lane, they have a symptom, they get tested, they automatically become a PUI. My comment was in reference to those PUIs who are in the hospital already. So people are hospitalized for, pneumonia. Obviously, these days they will be tested for COVID-19, and they will have to put in COVID-19 precautions and isolations, which is much heavier for staff than, precautions you would use for a regular garden variety, so to speak, case of pneumonia.
Do we see anything else on the horizon? Every year it seems like there's a new flu that comes around. Do we have anything that we're worried about coming around this fall? And when we get into flu season, is there another one they're warning us about? Every year they say, get a flu shot, and
Sure.
it's usually they try to pick something that they think is going to attack us. But what do we have to look forward to this year?
You can certainly bet all the money you can on the fact we will have flu this year, just like we have every season. Of course, the interaction between the seasonal influenza, as we call it, and the COVID-19 virus is going to be really interesting, to say the least. And we are already working with our medical community to set up some protocols that we can put into place to just do the right triage for people. I mean, does everybody get tested for COVID-19? Do only certain people? And where do they get tested? Do we send them to special testing facilities? Or those are conversations that are just starting now in time for September. Interesting enough, the CDC announced 2 weeks ago, and I don't know if that's already commercially available or not, but it should be in time for the flu season. They announced a new test that will test the same specimen for seasonal influenza and COVID-19. And if this test proves to be reliable, that will go a long ways in assuring more efficient and effective management of those patients. Of course, I have no idea at this point whether the test can be done on-site. It has to be sent out to commercial labs, and in that case, if there is another return time of 7 or 10 days, it's not going to be very helpful.
People who have the T cells, do they have a much higher resistance to this COVID now? I'm reading some about that some people even have some of these T cells from vaccines from last year. Does that affect the testing? We don't know yet.
I don't think so. I mean, if that was a significant factor, you would have seen that already translated into different rates of transmission in our communities. I mean, clearly, this was identified as a pandemic, and the definition of a pandemic is that you have a new virus or bacteria, but they're usually viruses, that start circulating, and that nobody has immunity to that particular agent. And I think for practical purposes, that still holds true, where there are very few individuals that may have had immunity before they came in contact with the virus because of some particular conditions they have. I don't know, but from the practical public health point of view and control measures point of view, I don't think that makes a difference.
Is the virus mutating in any way that we can see?
The virus is always mutating, like all viruses do. At this point, there is no clear evidence that the virus has mutated in a way that would make it less or more infectious. There were some preliminary reports a couple of weeks ago that might be the case, that there was one particular mutation that could improve the ability of the virus to be transmitted. This is already a very efficient virus in terms of transmission. But those were preliminary reports, so it's too soon to tell. The other element that you may have heard in the news is the possibility that this virus is actually airborne, What that means is that it transmitted through the air and not just through direct contact. Now, that may be a little confusing to people, but let me explain very quickly what the difference is. Direct contact means that there has to be a contact within, 6 feet or less, in this case, for the virus to be transmitted. So it doesn't necessarily mean you need to touch somebody or something. It means very closely. And the virus then is transmitted in the large particles of saliva that are ejected when we talk, sneeze, or cough. Airborne means that the virus can also be transmitted by tiny particles, much smaller than the large particles involved in direct contact, that can linger in the air. And we have some egregious examples of viruses that are very good at doing that. The measles virus is perhaps the best one, where you can somebody can catch measles just by walking into a room with poor ventilation where a patient with measles was up to 2 hours before the second person walks in. We don't know if this is the case for COVID-19. You may have heard, because in main news, that several, I think it was a couple of hundred scientists wrote to WHO to please reconsider their classification of this virus as purely direct transmission, because there seems to be growing evidence that this may actually be also not just direct contact. Direct contact that's true. That remains true. It's not instead of, but in addition to direct contact, the transmission maybe also happens through the airborne route. And that would have huge, huge implications for the way we control the virus.
Mr. Chairman. Dr. Pizzino, one of the questions that we often see in emails is concern that we are going to go back to a safer at home or lockdown for our community. In the slide that you showed earlier with the positive rate of tests, it looked like back on March the 9th, we were at a 9% rate, 9.21, there you are. That takes us back to March the 22nd. And we stayed under that until that June 28th. Does that positive lab test mean an implication of when we should look at a moving back or safer at home type of work?
It's one of the elements we would consider, but not the only one. This is a tricky chart to interpret. You cannot interpret correctly without putting it side by side with this one. Look back in March. We did 240 tests in a week. We were only testing the very sick people. Those were primarily done on hospitalized patients. I believe at that point there wasn't even an outpatient site where people could go and get tested in Topeka or in Shawnee County. So clearly, when you select your testing sample by choosing, was a necessity, wasn't a choice, but by only targeting the people with severe symptoms, then you end up with this kind of number, 9.2%. Compared to where we are today, almost 2,000 tests done every week, and we are back at the number. So that's a comparison we need to do. So one chart without the other doesn't really tell the whole story. When is the time, if ever, to go back to that kind of measures? I can tell you this is definitely one of the things that people look at. The other thing is, by all means, the burden on hospitals and the burden on public health. If we lose total control over this virus, I think we still have some level of control. We are still reaching out to our cases. In some cases too late, but in many cases early, and hopefully that will improve. If the numbers go up much higher, though, we may lose that advantage. And the hospitals may find themselves under a more severe burden where not only do they not have the staff, but they also do not have the beds to take care of patients. I'm not in a position to make any predictions. I'm not in a position to tell you we will have another lockdown. Believe me when I say I will try all my might and all my best to avoid that. I know how hard that is for everybody. And I'm working very hard. That's why I come here every week, every 2 weeks to, give you these numbers and hopefully share these numbers with the community for everybody to understand we got to do a better job now or we are going to pay a much higher price later.
I think going back to February, when you first came to talk to the commissioners individually about this virus, you expressed even then that there was no way that we would ever control it or conquer it. The best that we could do was slow it.
Mhm.
And people come up with catchy phrases such as flatten the curve, which sounds good on a postcard, but I don't think it really makes a good representation of what we need to do, which is the slowing, much as you talked about overtaxing our hospital staff. And if we have too many people out because of the virus or on quarantine, that will overtax our hospital staff. Is there a better way that we could publicly report the impact to our hospitals so that people can have, I think that's maybe the one piece of missing information is, you know, how far to the cliff are we before we go over? Or is it that you look at, we have 330 active cases in Shawnee County, you're already at the cliff. All you need is a percent of those individuals to need hospital care, and it will overwhelm those hospitals. And I think that's the piece of missing information that the public maybe has.
Right. I think you're absolutely right, Commissioner Cook, and that was part of the conversation I was having early this morning with a hospital executive. She was telling me, if we just look at hospital beds and hospitalization numbers, you are not giving the whole picture. So yes, I think there is a better way to show that. I can tell you exactly what it is. It may take a little bit of time, unfortunately. I think we have the information. It's just a matter of finding the time and the skills and the resources to manipulate that information and make it, turn it into presentable data that can convey the message. And we will definitely work on that. The other element of what you're saying is that it's not just hospitals, it's the entire economy at large. We already have several public establishments who are forced to close 2 weeks at a time because they have cases and they have too many employees who are either on isolation because they're sick or on quarantine because they were exposed to somebody in isolation. So this is way too much virus going around to keep it under control. And you're right, the goal was never to eradicate this virus. This virus will possibly never be eradicated, and it will never be brought down to a level that is much more comfortable until we have a vaccine. But this is too high. This is not something we can cope with. This is not something that our economy can cope with. This is having a severe impact throughout all different sectors of society. So the goal is not to make it disappear. And, you know, we never flattened the curve. We never flattened the curve as a nation. If you look at the curve in the United States, went up, then there was a plateau, and then went up again. That's what happened. Now, Shawnee County is different because we started our control and containment measures very early. So we never exhibited the sharp increase in the plateau, but we are experiencing now. We are in a position now where we can't keep it outside of our community anymore.
Dr. Penzino, I noticed nationwide, we're getting a lot more cases, but our death rate's going down.
Mhm.
Is that because we're just better at treating people, or is it because a lot of our new cases are younger people that are, by and large, not affected much by the disease?
It's both. It's both. We are definitely better in treating people. You know, our clinicians have learned from having hundreds and hundreds of thousands of patients throughout the country treated. And we also have younger people being infected, and that's why the hospitalizations are going out. However, there are signs from other states that now the deaths are also starting to climb again. Because again, you can't, the youth get it, and then they transmit it to other people at high risk. And then there is a third element that sounds a little cynical, and I don't know how true it is, but some people said one of the reasons that the deaths went down is because a lot of the most vulnerable people have already died. That's certainly not the case, of course, in Shawnee County, but if you look across the nation, what happened in Washington State, in New York City, that may be the case.
Herd immunity. Are we getting close or not even close?
So, okay. There are, let me get my numbers straight. I think there are about 3 million cases of coronavirus in the entire country, confirmed. The most current estimate is that for every case that's diagnosed, there are 10 more that are undiagnosed. So that would take us to about 30 million people infected. That's not even 10% of the entire population of the United States. Now, obviously, when you go into different pockets and states and communities within states, those numbers change dramatically. But even for New York City, which is arguably perhaps the most affected place in the country, the estimates I saw was still below 20% of the population as having been infected. As you know, the target number is between 60 and 65% before the herd immunity may kick in. So that's why most people think there will be no herd immunity until we have a vaccine. And then you can combine natural infection and vaccine in a controlled way, and maybe within a period of a few months to a couple of years, you can reach herd immunity. And then there are challenges that will need to be maintained, because there are constantly people moving out of the community that because they die or other reason, and new people coming into the community. And so those new people also will need to be protected through the vaccine. And so it's an ongoing process.
Do we know if herd immunity works on this virus?
We don't for sure. We hope it does. We don't for sure because we know that there are antibodies, and we know that for the vast majority of people, those antibodies are what we call neutralizing antibodies, which means they will inactivate the virus. What we do not know is, number one, is if everybody who is infected develops those antibodies. That's still unclear. And number two, how long does it last? Because people develop antibodies against the common cold, which is also coronavirus. But as you know, that immunity lasts for just a few weeks or a few months, and then you get the cold again. It's still too soon to know if that's going to be a long-lasting
So
effect.
with that in mind, would a vaccine work?
Well, the vaccine that they are trying to develop, the vaccines they are trying to develop would be developed in a way that could confer more prolonged immunity, possibly, than the natural infection. But, that's a good point. Is it going to be one dose? Or are we going to need to repeat it just like we do with influenza?
Will it be like the common cold? We've never came up.
Hopefully not. I think the example that comes the closest to that situation is really the seasonal influenza, where there is some level of immunity, even without vaccine, there is some level of immunity that people develop from, having contracted influenza the year before. But the virus mutates and changes every year. And so maybe we may need to repeat the vaccine every year, or maybe we need to give booster doses every year. That's still very much to be determined. Huge questions and huge implications from the logistical, economic, and everything else point of view.
Mr. Chairman.
Yes.
Dr. Pizzino, you asked us to consider three things. One was any modifications to our orders that are in place. I would hope that we don't make any changes at least until next week. We don't have a meeting scheduled for this Thursday, so at least until Monday at the very earliest, but if not next Thursday, so that we would have more data, more information. You also asked that we bring into place maybe law enforcement, the district attorney, to talk about enforcement and how we would look at what enforcement is taking place and what changes to enforcement may need to take place. And maybe that would happen at that same meeting, inviting the law enforcement participants to be here. I think the third was working with the county counselor on any tweaks, minor.
No, I thought the third point was about marketing and
PR.
public communication.
And
So
and by having our PR, I mean, we do have now Amanda Munholland hired as the public information officer with the Shawnee County Commission, and maybe that would be a good project for her to start on. First project.
We are actually already working on that in our PIO group throughout the county with all the PIOs. And that is a campaign we are talking about and discussing.
Great.
Yep.
So,
And to your first point, Commissioner, I absolutely agree with you. I have no intention to propose any changes until next week. And so if that's agreeable for you, maybe this week we can work with the counselor on, if there are any changes, Paul, I don't even know, but in case you identify some areas of attention that need to be addressed, we will come back to you a week from today. And I think having our law enforcement representatives would be great at that time, because then they can hear the same story and maybe they can give us some ideas of how we can make enforcement more efficient.
so, Mr. Chairman, if you could maybe ask that a law enforcement officer, have Susie invite the law enforcement participants to be at our, whenever we schedule
Next
a
health.
meeting
Okay.
at Board of Health, whether it's next Monday or next Thursday.
Okay. One other point, there's a lot of people out there just scared to death of this thing. And I was wondering if there's any way we could get out to the public, what's your percentage, or what are your chances of actually dying from this disease if you're like under 20, or if you're under 50? We have enough data, I think. nationwide.
Generally speaking, what I saw, that may not be very reassuring, but what I saw is that within each age group, if you contract coronavirus, your chances of dying within that age group about double. Now, that may sound scary. At the same time, people who are age, 35 to 44, their chance of dying in general is pretty low because, unless they have some condition. So doubling something that's already very low is probably not a big deal. My message would be maybe slightly different. It would be, there are ways to prevent infection. If you follow the right precautions, mask, good hand hygiene, good social distancing, be careful who you associate with, your chances of being infected are extremely low. And if you do get infected, and if you're not in a high-risk group, your chances of recovery are also high. But I wouldn't do the one without the other. I think just giving people the reassurance that, if you get it, you probably won't die. Yeah, it's true, you probably won't die, but I still would discourage people from getting it in the first place.
Yeah, I agree. Nobody wants it, but to certain age groups, like under 20,
Yeah.
they're just
Yeah,
hard.
and again, the reason we really worry about people under 20 or, 20 to 30, my youngest son is the age group, 20 to 30, and smart kid, I still have to talk to him about his social life. And he's in graduate school for a health profession degree. So it's not like he's dumb, and so it's a challenge. They are invincible, they are immortal, and that's what I think. My concern with the group is not about themselves. It's about them transmitting to people like me. I haven't been able to hug my youngest son for weeks for that reason. And he's been banned from our house for the reason. I mean, like parents would do, not banned in a bad way, but say, hey, son, I'm sorry, can't come here until your social life takes a different turn.
Okay. Any other questions? Thank you, Dr. Pittman.
Thank you.
Anyone else? Nothing? What's next on the agenda?
Executive sessions?
We have no need for executive session, so we are adjourned. See this, purple?